I've listed a set of them here. Some of these were suggested to me in person. Some of them were suggested to me via the surveys, and I apologize if I'm not doing them justice by the abbreviated description I've had to use for this slide. So I'd invite those who have suggested these to stand up and speak about your interests if you'd like to do so. So the first of them was sort of multisectoral strategies for developmental health for children. The idea here, as I understand it, was assembling. It has to do with the issue of focus on child developmental health, assembling stakeholders across a wide variety of domains, and trying to figure out effective strategies that would improve early childhood development. Does anyone want to comment on this issue a little bit more? Okay, great.
Sure, yeah, so this big project is based in Mississippi, and so they put intensive efforts into intersectoral coalitions, forming them, learning from the development of children in the community. And most recently in 2012 and 13, they've been working towards implementing one child model, so having sort of all the things coming together, having a one-stop shop for families, and also having a new sort of state-of-the-art health center that means primary care providers, pharmaceutical services, urgent care, all again in a one-stop shop. So quite a bit of government investment there in the last year.
Right.
And before that, was probably about 10 years worth of a lot of coordination and coordination. So we have population level data showing what the developmental health of children are all across the state, but in that region, we know that a third of the children are developmentally low. So we'd like to see with the service utilization data that we have, whether we can see patterns around what services are being used, variation, whether uptake.
Okay, and is that very interesting? This data that you have, is it cross-sectional or longitudinal in character? Or is it?
No, it's actually longitudinal.
Oh, okay. See, one of the reasons I asked about that is, and we'll have a more textured discussion of this later in the week, but one of the nice features of an agent-based model, when put in the context of other types of dynamic models, is the capacity to collect information about synthetic longitudinal trajectories from the model and use them to compare to or make sense of, actual longitudinal data that one has. Whereas certain other types of models, such as departmental models, for example, that really isn't practical in a general way. Accumulating arbitrary history information about a person's contact with the healthcare system, or about even aspects of their history that may be important, such as birth weight or sort of prenatal environment or that sort of stuff. It's not going to be that feasible, whereas it is here. And one of the lectures you'll hear later in the week, at least, will feature discussion of a database that was exactly that. It sort of captured longitudinal data on individuals in the model that was comparable to similar data sources in the external world. So that's a considerable attraction of agent-based modeling for a lot of people. AnyLogic is currently investing as a company in making this super easy to do. Right now, we have some of the example models that I've provided you. At least one or two of them have mechanisms for collecting a sort of history information. So that may be of interest. And so when one thinks about development, it's inherently a dynamic perspective. A perspective over time, and often we're interested in life course issues or issues having to do with a given individual over the course of many years. So I think a longitudinal perspective is particularly apt or desirable, and it is something that can be enabled. So great, I appreciate the comments there. And so you would be sort of perhaps the lead for people to see on this one.
Yeah, with just the note that this is just a very preliminary, it's just the idea. And we know that the database exists, but we haven't actually looked
Okay, and if I could trouble you just with your name so I could put it down? Brenda, okay. Great. Okay, another one was cost-benefit analysis of vaccination treatment programs for captive herds. Is that?
Me.
Yeah.
Yeah, so I work for the San Diego Zoo as an epidemiologist there. And one of the herd health problems that we have is copper deficiency in our ruminant type of animals, so cattle, type, deer type of animals. The problem is lack of the soil in that area and soil and water in that area. And so there's a couple of different options for treatment. One, feeding them a couple bolus. Another one is supplementing some of the food, and another one is doing some large-scale water treatment, which would probably be very costly. So that's sort of that particular problem. If people are interested, I was actually just thinking of another interesting problem for modeling, and that is looking at networks of birds. So thinking of a group of birds in an enclosure as a network of birds that are all having contact, and we have issues, with captive birds having mycobacterial infections, but they can spread to each other. But what happens is we have this tight-knit network, and then we move a bird to another enclosure for breeding purposes, and it sort of loses its connection to the previous network and has a new network. So the question would be is how far back in time do we need to go in terms of searching for the relevant network of bird when we recognize the disease. So I would be game to do either one, but those are kind of two.
That's fantastic. I must say I've been very impressed by Carmel's existing work in other areas. She has a very nice model of Jonas disease, which I've seen quite a bit of, and we'll have some discussions about that as well, sort of on a discussion of how to advance that. But these would be projects which would link in, it sounds very well, with sort of your experience with the San Diego Zoo.
Yeah, and I mean, I have the Jones disease model that I've been working on. I kind of feel like that's at a particular pause right now, but certainly that's something that we could work on more. I'm interested in looking at incorporating herding behavior across different species.
That's exactly what Gregor's worked on right now.
Yeah, so that would be something of interest to put into that existing model. So I've got too many questions and too many exciting things to model, but I'm
Good.
open.
Thank you very, very much. One thing I'll just mention here, and I'm just throwing out things that I think you folks need to know about. With respect to cost-benefit analysis, I recently posted a model that was stimulated actually by someone, I don't know who it is, someone posted on the survey they were quite interested in cost-effectiveness analysis and its use with models. So having done formal cost-effectiveness analysis before, I decided to put together a model in a set of sort of mini tutorials that are now on that lecture site I showed you earlier, which are basically talking about how to use any logic for cost-effectiveness analysis. And okay, so the idea is that it shows how you can run, say, within a given experiment, you could run on the one hand a baseline case, and then on the other hand an intervention case, and look at the incremental cost-effectiveness ratios. Do discounting, and compute qualities across the population, intervention costs, as well as cost of being in certain health states or what have you, and then look at things like cost per quality gain, that sort of thing. So this would apply as well to cost-benefit sort of calculations, in as much as you're comparing some baseline with an alternative and trying to ask what's the gain. So I'd be glad to show that model at some point if there were interest. You can find my video on it. I bet you 3 mini videos I made a few days ago. Just showing how it's done. Great. So another one mentioned UAH and resource-constrained sort of waiting times, as I understood it, for trauma care and organ transplant, where the waiting times may may not be always in line with sort of reported time to care, historical data, that sort of thing. Is that someone else here? Okay.
You know, it came out to be a model.
Yeah.
Bring down the word start. Yeah, we're a big organigram center, complex, and working out the experience because of that. All of them will think of it, you know, what's going on, traffic lights, kind of handle boundaries, challenges, but I know it's simple, it's more of a simple problem. I don't understand, I think you're scratching your head. Why am I in this place? I work almost at an airport there, yes, it's complex, but empty order, like to have a procedure.
Oh, that's interesting. So that could be the basis for a project, I guess, something like that.
There's another interesting problem is that the health machines who go out and accept these patients on the board, they don't have much control of who the patients are. It depends on the quality of care that the patients on the boards. There's shedding light on patient experience very rapidly. And there's just some variables put in there how the patient is treated.
So I appreciate knowing about that. One emphasized, one point that came through very clearly in student feedback through the surveys was that there's substantive interest among this group, broadly speaking, in cross methodology models, so models that are hybrid. And one of the biggest uses we've seen of that, and one that's really emphasized by this latest iteration, the Antibiotic 7, is hybrid so-called discrete event and agent-based modeling. The idea being that with traditional discrete event modeling, the focus has been very much on sort of passive agents flowing through a set of processes. So you get sort of a faceless patient comes into the facility, they're routed among a set of processes, workup, diagnostics, treatment, discharge, that sort of thing, and then they disappear from the model. And you can look at throughput of patients, and et cetera. But what you're often missing there is really substantive feedbacks that, for example, if there's lower quality care conferred, that patient may represent, a few weeks later, for example, or a few days later. And unless you represent that patient as they go out into the community in some fashion, you may be overly optimizing just, the sort of timing of their care while in the facility, and you won't be capturing those really important feedbacks about what's drawing people to the facility, what's keeping them away from the facility, what's leading them to present only with severe symptoms rather than early on, what is leading to represent, et cetera. And so one of the things that we found very attractive for AnyLogic is the capacity to take a larger view, say an agent-based view of the population, and you think of a facility, say a hospital or say a clinic, as sort of having this catchment basin around it with a population with persistent state. And those individuals, those agents, do present for care, but they're no longer faceless agents. They're people with histories, people who have been there before, maybe whose path to care is shaped very much by the adverse or positive experiences they've had in previous encounters with that healthcare system. And that may have really substantive bearing on how they present, with what symptoms, how severe that has to be to draw them there, or what have you. And similarly, they're captured when they leave the facility as to whether or not they're truly cured, whether or not they're really resolved from their condition. And AnyLogic, better than any platform out there, it makes this straightforward to do. We have a number of hybrid models, quite a few hybrid models I've provided to you, and some of them involve this sort of nexus between discrete event modeling and agent-based modeling. However, AnyLogic 7 just takes us to another level. I mean, it's very, very impressive, extremely impressive. But what I will say is that AnyLogic has a very articulated way of representing these flow processes within hospitals and so on. This whole patient flow process that you're talking about, what goes on in outpatient, what goes on inpatient, what goes on in the ambulance, what goes on in the emergency room, that's all part of that milieu. And I don't know of any better tool for investigating a lot of this than AnyLogic.
Yeah. Do you want me to show the input model?
Sure, maybe, yeah, I think that's a great idea. I think what we should do is we should try to get through the other topics, and then we should be sure to do that. Maybe it's in a subgroup context, so that we could, or maybe other people will be interested. Let's see as we get through this other one, okay? So great. And that's the AnyLogic 7 presentation?
No,
or
this is something I built last year, so it's all in AnyLogic 6.
Great. Okay, and that was the one that Andre saw and so on. Yeah.
Yes.
Okay, great. Yeah, that would be fantastic to see. In fact, maybe we could, well, okay, we'll get to that. Yeah. Okay, dynamics of vector-borne illness. I think this was dengue fever. You were interested in chikungunya. Okay, I was just saying vector-borne illness. I thought maybe. Sure. Sure. Okay. Okay. So it sounds like there may be perhaps two people that would have enough shared interests that you could potentially collaborate on something, if it incorporated enough of both sides to it. I know one me here also I mentioned, you want to raise your hand? She's also done a very significant amount of work with West Nile infection here in the province, and has actually a little model she'll show at some point, which is a hybrid model, taking into account both sort of stock and flow, in other words, sort of aggregate dynamics associated with some things like the mosquitoes, et cetera, and then putting it into a spatial context that's agent-based, which may be of interest. So vector-borne illness is spanning, is there a particular strong interest on the dynamic side in one or two vector-borne illnesses, or does it include everything from, tick-borne to mosquito-borne? Okay. Okay. Okay, good. Yeah. Right. Yeah, good. That sounds terrific. I'm trying to find good matches of student interest, talent, etc. to these projects. So that's good. Okay, so vaccinations and sort of outbreak dynamics. I think that was do you want to say a few words about that?
Yeah, I think this could be often vaccination is in the context of the vaccination disease or it's used in one way or another. So often the question arises some outbreaks actually follow the natural
So new vaccine, and impacts on, infectious disease epi, yeah. Okay, this is, so this is, just taking down some of these that came up, so bird networks, so I'll put in there. Okay, so that's interesting. Now, to what degree are you talking about also, so when it comes to vaccine rollout and so on, of course, there's a whole sub-area associated with scaling up vaccination efforts, dealing with logistics and delays associated with the pipeline for getting the drugs, and dealing with health service delivery delays and actually administering the vaccines and so on. Some models include that. A lot of the time, those models aren't really associated with really rich infectious disease transmission. For any logic, I have seen some models that are, again, hybrid models, where you actually have a vaccine delivery component simulated in discrete event modeling, where you have people queuing up and, nurses providing the vaccine, and it takes a certain amount of time per nurse to provide it, and there's certain doses of vaccine needed, and there's perhaps supply chain delays associated with getting vaccine, and people are waiting in line, and et cetera, and then coupled with infection transmission. Is that something which you're concerned about?
That probably would be the context of some
Right, exactly.
So, but what I meant here is sometimes it's not, it's still that component of vaccine delivery is always there. So the economic side of it is always taken into consideration. But some of them may not necessarily be that important.
Right, understood.
For example, it could be, it's not clear yet, but probably it's less than do that.
Hep B, yeah.
No, they're not happy.
Oh, meningococcal, okay, yeah. So, Neisseria meningitis? Yeah, okay.
This one is in a pipeline, and it's less than this is just one of the examples.
Right. Very good, very good. Okay, that's helpful to understand. Okay, the final one, which people had mentioned earlier, was participation in hypertension oral health screening. I think this is from the colleagues at Buffalo. Does anyone want to say something about that? Very good. Okay, that's much appreciated for your comments on that. So I hadn't realized that the full scope is that with Mary Northridge and so on? Okay, she's wonderful. Also the executive editor of American Journal of Public Health, I think, and a big supporter of system science and health. That's great. So we have a broad spectrum of possible project ideas here. Is there anyone who just in talking about this has come up with additional ideas you'd like to share?
topics you'd like to come out with? Remember, this is your chance to kind of advance your advance ideas that are sort of inchoate. Explore topics with the help of a variety of folks. Yeah. Aha. Yes.
So I'm interested in trying out hypothetical intervention in social networks or social environments to see, say, adding an XY or, the one communication from another, say different incidents that can happen in a country like
Mm. Okay, that's very, very interesting. Mental health is a topic that is now starting to get certainly a lot of interest in assisted science. I know several people working in applying agent-based or system dynamics modeling within this area of the States, and it's I think it's much needed. It's also one where capturing the social context, as you say, could be really, really helpful. Some of the things you were saying, though, also reminded me of the fact that sometimes, one of the uses of agent-based models that gets less billing than others is the fact that they can be used sometimes to even not only evaluate intervention strategies, but evaluate study designs, for example. Help inform what the study design would need to include, or on what it would need to collect information to most effectively reach its goals in terms of sort of the statistical power, or in terms of the sort of accurate, robust measurement of underlying factors, and maybe that there's a role there in sort of informing the study design as well, which could use these models. So that's interesting. It reminds me a little bit of what I think it's Jennifer Runkle that you were saying. You were interested earlier in this whole role of social networks, and maybe I didn't hear you right. I thought it was sort of environmental factors and sort of shaping risk factors, be it for communicable illness or maybe for chronic or mental illness as well. Yeah. 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 Hmm. Yeah. 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 Right. Hmm. I'm involved right now with some work with Anylogic. We've got to submit to American Journal of Public Health on a sort of multi-scale model that involves developmental issues during pregnancy and perinatal period, and then first years of the life of the child, and then both mother and child, and trying to understand as well as how some insults in pregnancy and early life exposure may shape later outcomes. Dylan's also done some early sort of probing work with
gestational diabetes, which is a gestational diabetes sort of systemodynamics model. He helped adapt to an age-based form, and that's currently sort of circulating, waiting for the next step to take it forward. But he has some familiarity with that. And some of Kurt's interests also in social determinants of health and the role of networks in positive self-regulation and sort of sense of self-efficacy and so on. They may also get into a little bit of this mental health issues. So Kurt would bring to bear a impressive set of technical skills at Papa, and appreciation for these issues. So that's good. Anyone else want to sort of bring up? Yeah.
Well, I'm just thinking about the topic right now about antibiotics.
Oh, okay.
Superbug antibiotics, a scarce product on new antibiotics is an issue.
Uh-huh.
We can study the dynamics of antibiotics, the rate of fusion of antibiotics, the mutations, the resistance trends.
Yeah.
See how this works.
Okay. That's great. Nestor, you're with our School of Public Health here, I think, right? I think that's very interesting. Antibiotic resistance is, as we all know, a rapidly rising problem, and it's one where the tools of agent-based modeling can offer sometimes really very, very important insights, in part because they do allow for simulation, potentially even at the level of the allele level at sort of mutation of organisms, but also allow you to sort of be quite specific about intervention strategies or simulating the environment in a way that's, captures networks of use and prescription at the individual level, et cetera. Cheryl Waldner, who's actually not here right now, but is one of the participants of the boot camp, is quite an expert in antibiotic-resistant organisms. And we have some work underway with AnyLogic, actually 2 lines of work, trying to make sense of the development of drug resistance. One for gonorrhea, another looking at also for gonorrhea, looking at more of a molecular biological level. In other words, sort of the actual mutation and selective pressure from interventions. Because this is one of the areas where system science methods are seen as so key, because it's a blowback situation where you undertake some intervention, but there's selective pressure that may be introduced because of that shapes things in a new direction. So that's really nice. I think docking with some of the potential of what we're talking about here. Maybe Cheryl will be interested in exploring that. Okay, any other topics? So, Dylan. Very good. Much appreciated, Dylan. That's good. I might note that there's also some interest in alternative disinfection and cleaning regimens, and the ways in which there might be blowback occurring at the level of use of sort of overuse of disinfection agents as leading to mutation of bugs, and proposing the use of probiotics as an alternative. So essentially, instead of doing cleaning and disinfection, which wipes away a lot of the bugs, but keeps some of the real nasty ones around in small numbers in a way that could easily repopulate the surface, instead of using competing bacteria. This is an area where there's some really interesting research going on. If people were interested in that, that would be something I could provide some literature to. But had some ideas about what a model might look like there. Anyone else with project ideas? Yes? Sure.
Like how can you math model and dictate your policy?
Yep.
In the area of policy reviews, you can model health parties and what people take your The grants from NIH can kind of do that, but on another thing is more on the application of math modeling to like health in general, so more ideas about how to use math modeling in kind of environment kind of sense or drug development or any kind of ideas that people have on how to apply math more to the health kind of landscape of the universe. I'm not sure some of these projects will like brainstorming, but that's something I would.
Okay, that's we have some ideas that might be. Yes. Mm. So how you might work to make sense of this sort of massive stores of information that are being accumulated. Yeah, exactly. So that's really good. I think several of us in the room, Kurt, Dylan over there, actually Dr. Yu here, Eugene Yu, who's a professor of math and stats, have also been sort of have been involved at various levels with this issue of big data. I don't know if you folks are familiar, but Dylan over there is the inventor of a very, very powerful a smartphone-based data collection system that's being used to catalog, among other things, aspects of exposure. That isn't our primary focus, but it is something which is going to be probably very strongly emphasized in coming months due to some work for American Legacy Foundation. And we have sort of databases at the multi-minute level on social contact networks and people's movement patterns and people's as well as the physical activity on responses to surveys cross-linked with those. And there's a lot of interest in using this on the exposure side to help understand exposure to environmental risks like, mosquitoes or like air pollution, but also things like exposure to messaging, so tobacco messaging or exposure to drinking related messaging, which might dovetail with some of the issues you're talking about. So we've done quite a lot of work, including much of it with AnyLogic, most of the simulation modeling work with AnyLogic, on bringing together these aspects of big data, these massive databases of sort of sensed or collected data with simulation models, where the simulation models help us understand help us link that data up to outcomes of decisions, so outcomes of choices, so we can simulate the effects of interventions in a way that's informed by this data. And so we found the simulation model is a very powerful tool for doing that, but we're in agreement that with others in the field that there's a lot more work to be done about how to make sense of this data, and I've been working with Dr. Yu here on sort of some inferential techniques that might be used based on Bayesian approaches to make sense of some of this data, but which end up being also working with agent-based models such as from any object. So we've sort of been dealing with this space and trying to fit out multiple modeling types best are used to shed light on this sort of types of data that are emerging from these many sciences. So that would be a very interesting topic of discussion. And if people were interested in little bits of work along those lines, someone like Dylan, or where's Chen-Wei Chong? There he is. Okay. Chen-Wei Chong has done, Winchell in the back, has done quite a bit of work actually running any logic simulation models using data drawn from smartphones or contact patterns or mobility patterns too. So he's been interested in building generic mobility models, although that is the fundamental thrust. It's something it's a point of interest. And so, in short, there's a lot going on here that you might find people in the room actually able to really, wrestle with some aspects of this problem and talk about how would you use any logic in that context. In a concrete term, how would you bring them together? That's something that I think Chen-Wei Chong and then myself, Dylan, and Kurt might be able to comment on especially. That's good. Anyone else have other topics? Yeah.
Well, in reality, my topic is, I would say, similar to the one from you guys, the Buffalo University, where I think you are talking about participation, hypertension, and oral health screening, and influence of social support. Well, all that similar to what I'm trying to do for a while, which is related to colon cancer screening, colorectal cancer screening. The idea is kind of similar. We're trying to figure out what are the factors that are determinant to influence people to get tested for colorectal cancer screening. And this is based on personal perceptual values that the population that we are studying has. In our case, it's the population from the surrounding area of one of the hospitals in Philadelphia. So we have the data from these people, and we are working on how we can present this for public health support. So in a way we can help them to make decisions based on behavior, and the behavior is based on this perceptual model. And so for doing that, there are two factors we are considering. One of them is that we calculate the subjective well-being based on this perceptual model. So we are able to determine on the fly, at one time, this value. And the other thing is that we are translating all these perceptual values that are at the multidimensional level. We have 24 factors that we are tracking using multidimensional technology, let's say, and we're transforming that into a 3D space, and we are plotting that in 3D. So you can see the trajectory. When you do an intervention, then agent center moves in that trajectory in this 3D space. So something that you couldn't see in the 24-dimensional space, you can now see. So that if you mix it with the other factor, which is the well-being factor, then you get a very powerful way to determine, analyze the effect of your intervention. And I think of those topics, the one that is closest to that is that one that you have the working there.
Very good. Thank you very much, David, for letting me know about that. It's very exciting work, and it'd be nice if that could make some further progress here with some of the TA support, for example, et cetera. So anyone else want to sort of mention ideas here? I think this is an admirable breadth. It's So, yeah.
The other one that I have is looking at incorporating into a pre-existing model, spatial movement and human behavior and behavioral observation.
Ah,
So,
spatial movement, herd behavior, and heterogeneity.
yeah.
Okay, now that's very interesting. Not least because we've spent quite a bit of time in recent months analyzing characteristics of human mobility at a detailed scale, like at the scale of you know, can capture movements all through the day and someone's patterns, you know, maybe as small as sort of several meters or what have you, using Wi-Fi data, using GPS data, et cetera. And it's also something, of course, we have going on for this chronic waste and disease model, which you'll see presented tomorrow by Gregor. So that remains of keen interest. I think for Cheryl, that's of interest. And where is Maria? There you are. Okay. Maria, do you want to just say something about your background too? Because I don't think I can do it justice.
Yeah. Well, I'm a veterinarian and I'm working with chronic waste and and we are looking at movement and social behavior. So we actually go out there and observe them. So it's what I call real contact because now the word of contacting is pretty much defined as you are very close to each other, like within a meter or within 25 meters, and you assume they are contacting, they're touching each other, but we are trying to come very close to you all. So we go out and we observe the reaction of in different ways. We also write it down with GPS there, so we have lots of locations and you can determine when to hear we're close enough because if they so and we are trying to also do a social network analysis to determine which are the guys that are the most popular ones and if they share some characteristics as being adult males. I'm guessing that they would. So adult males might be the most popular guys. And then we have trail cameras in the field that can tell us which sex and age classes visit different site types more frequently and which type or in which season they do. So we could probably tell people where to vaccinate them. If the vaccine comes out and it's orally available, we can probably say the chances for you to find the most popular guys in the network are in, I don't know, rut season in salads. So it will be very narrow down. So it's focused on coming up with management options that are more realistic or more efficient at the one that we have now, which is wow. And it's not working. We think it will work and but it doesn't. Like that.
Very good. Thank you very much, Maria. And it's an interesting set of interesting commonalities, but also some sort of distinctions with, I guess, both cases work with ungulate herds, but in one case captive, and in one case, in a smaller, relatively smaller area, and then in the wild, but over a much larger area, I guess. Right. Yeah. So that's very helpful. Thanks. So yeah, we have an admirable number of projects here, and so we're going to be embarking on something entirely new here, which is trying to catalyze the formation of project teams that could advance some of these projects over the next 4 days, 5 days for this thing, for Saturday. The hope here would be to have ideally a couple of people working on the project. All the projects would be facilitated by TAs. sometimes the TAs might be working as more core members of the team, sometimes circulating. I will be circulating and sort of giving advice, suggestions, and pointers. But the idea would be to try to use these afternoons essentially to substantively advance these things. Now, I've never done something quite like this before. I was advised for those who have that sort of the best modus operandi is to let people self-select, each particular topic. So I don't know what you folks are thinking in terms of what's most interesting to you, but my suggestion is that we use the next little bit of time to sort of maybe meet up. This is almost like a speed dating thing, where there's people from technical background, there's people from variety of other domains, application domains, and maybe there could be some horse trading going on, so to speak. Some meeting up, brainstorming about, this might be an interesting project. What are you looking for, etc. And then we would try to sort out, ideally by the end of the day, the projects that are most likely to kind of go forward in the short term. And we make sure that each of those is supported by the appropriate TAs. Now, if a TA has a really abiding interest in one of these projects, as I said, they could be a more core member and just spend a little bit of time on other projects, because I like to encourage TA interests. And if you folks want to grab a TA and try to persuade them to, get over here, you're welcome to try to do this. That won't be so effective at grabbing me, because I have other additional. I'm going to be circulating more broadly, but I'd like to encourage people to think about which of these potential projects is most interesting to you. A bit of time to talk and learn more about these and figure out which of these seem most likely to be developed actively during the next few days. I will say this: if there's anyone who's absolutely committed to a different program of learning where you'd like to put a premium on doing the exercises instead of this, I recognize people are here for all different reasons, and if some of you want to say, look, I don't want to do a project now, what I really want to do is go through these exercises, these 10 exercises, and try to master any logic as a tool as much as I can. I'm also open to that. We'd be glad to have TAs provide some support. There's literally hundreds of pages of material for you available in this book to guide you through, and we're glad to sort of help you with those projects, but help you with those exercises. My thought would be if we can identify a relatively smaller set of projects. I'm thinking something like 12 or something like that at most. Then what I could do is I could assign suggested exercises for each of them. Like people, it would help if you go through this exercise first or that one. So you get experience with networks, you get experience with spatial environments, you get experience with capturing aspects of context, with cost-effectiveness structures. Give you a couple exercises to do, and then you can just push forward aggressively on that particular model. That would be my thought. So why don't we take a little bit of a break right now and use this as a mixing opportunity, and people can talk and try to brainstorm about which of these they'd like to push forward. Okay?